Hi, welcome to this episode of Patient Education for the Educated Patient. Today we're going to talk about caffeine and its effects on pregnancy, and we'll also touch on breastfeeding and when you're trying to get pregnant. As you can imagine, caffeine use is practically ubiquitous whether you're pregnant or not. Caffeine is everywhere in our society, and most people can't imagine getting through the day without some caffeine or caffeinated beverage. Now, you can imagine when you Google something like this, you're going to get a whole range of answers. And so what I'm going to do is point you in the direction of some of the studies that are very well done, and then you can draw your own conclusions based on some sound scientific studies, whether you like them or you don't. So this way you can make the best decision for you and your baby. Let's get started. Starting with the take-home points as always. Number one, limit caffeine intake while you're trying to get pregnant, also while you're breastfeeding, and also while you're trying to get pregnant. Points 2 and 3, the FDA and the American College of Obstetrics and Gynecology have a rather strict daily cutoff of caffeine intake, and they recommend an intake of less than 200 milligrams of caffeine per day. The World Health Organization is a little bit more lenient and recommends you limit your caffeine intake to less than 300 milligrams per day. Number 4, coffees have different concentrations of caffeine. So that's going to be very imperative when you're trying to decide how much coffee you can drink, for example. So you have to factor in the concentration of the caffeine per fluid ounce, and then factor in how much coffee you're drinking. Is it 1 cup? Is it 2 cups? Is it 20 ounces? And so that will go a long ways to calculating how much your daily consumption of caffeine really is. And then finally, caffeine withdrawal symptoms are real. When your doctor's telling you that the caffeine withdrawal may be causing your headaches or your flu-like symptoms, he's not just trying to placate you. She's not just blowing you off or dismissing your symptoms. That's a real thing. And so if you're going to quit caffeine cold turkey, you should expect and tolerate some headaches or some flu-like symptoms, or keep this in mind so that you can encourage yourself to taper yourself off of the caffeine in the first trimester instead of quitting cold turkey. Now, caffeine is part of a family of molecules called xanthines. And these drugs include caffeine, theophylline, and 8-chlorotheophylline. It's very important because these medications freely cross the blood-brain barrier. They also freely cross from maternal circulation to the fetal circulation, which means they go right through the placenta. They also find their way into the breast milk, and we'll touch on that later on as well. So caffeine is found in a lot of foods and beverages, and you have to factor that in because caffeine is not only found in your daily coffee. And so when we say a 200 milligram per day maximum intake of caffeine, we're talking about all sources, not just coffee. So if you're eating all these other foods, you need to factor that into your total caffeine consumption for the day. That includes soft drinks, tea, coffee, energy drinks like Red Bull, chocolate, and over-the-counter medicines. Probably the most overlooked source of caffeine is in these over-the-counter medications. 2 very common medications that have caffeine are Excedrin and Dramamine, which has a 8-chlorotheophylline, also part of the xanthine family. And you can imagine why people are taking Excedrin during pregnancy. Headaches are very common. Caffeine withdrawal headaches are very common. And you can see why Excedrin works very well for a caffeine withdrawal headache because it does have caffeine in it. And finally, Dramamine. Dramamine is used by a lot of patients in the first trimester for morning sickness. But you have to remember that Dramamine is compounded with Benadryl, which is diphenhydramate, and 8-chlorotheophylline. They do that on purpose because the 8-chlorotheophylline acts as a stimulant to counteract the drowsiness side effects of the diphenhydramate or the Benadryl aspect. So if you are taking either of these medications, you have to factor in the caffeine in these medications and how it stacks on top of the caffeine you're getting from your coffee, tea, foods, etc. So this is the paper that we're going to talk about when you're trying to get pregnant. This is a study that looked at different behavioral or lifestyle choices that may or may not impact your miscarriage rate. And from their data set, they found two very important conclusions. Number one, taking your prenatal vitamins actually does decrease your risk of a miscarriage. So that's very important. That's what this female vitamin adherence is. If you're taking your prenatal vitamins, try to take them at least for a couple months before you get pregnant instead of when you find out you are pregnant. So it's going to be much more beneficial to you in your pregnancy if you start it before you get pregnant, not just because of a lower miscarriage rate, but for other reasons we can talk about in other videos. But here the hazard ratio was 0.45, meaning that you had a lower risk of a miscarriage if you had taken your prenatal vitamin much more regularly and strictly. So the other important conclusion they found is that increased caffeine consumption increased your risk of a miscarriage. And their hazard ratio is 1.74. Again, a higher chance of having a miscarriage if you consumed more caffeine. So they divided their group into women who consumed more than 2 cups of caffeinated beverage per day and women who consumed 2 or less cups of caffeinated beverage per day. Now, caffeine in pregnancy, this first study is from 2002, and it kind of illustrates why you have to be very careful about what you're basing your conclusions on. This is a study that looked at daily intake of less than 500 milligrams of caffeine per day, and they concluded there was no lower birth weight, no growth restriction, and there was not a higher chance of delivering early. But if you look at the acknowledgments section, they received financial support from the National Soft Drink Association. So you can see why financial support or disclosure from a caffeinated beverage industry might create bias in your results or your conclusion, your interpretation, the methodology, etc. But that's for you to decide. This other article about caffeine in pregnancy, also from 2002, they found a correlation or an association between your daily caffeine intake and growth restriction of the baby. They found that for every cup of coffee you consumed per day, there was a 28-gram decrease in the birth weight. Now, 28 grams is not a lot. That's less than an ounce. So their conclusion was, yes, caffeine may be correlated or associated with a lower birth weight, but for it to be clinically significant, you had to consume more than 600 milligrams of caffeine per day. Now, this is an article from 2007. This is a very good article because it's a randomized trial. What they did was take pregnant women and randomize them into 2 groups. The first group was instructed to start their day off with decaffeinated coffee. The second group was told to go ahead and start their day with caffeinated coffee. After their morning drinks, they were free to drink whatever they wanted with or without caffeine. And then they compared the outcomes for these 2 groups. And so upon reviewing their daily intake, what they found is that in the decaffeinated coffee group, the total caffeine intake was about 117 milligrams per day on average. Compared to the caffeinated coffee group, they had a daily intake average of about 317 milligrams of caffeine. So they had a low caffeine group and what they considered a high caffeine group. But again, both of these groups were below that 500 to 600 recommendation. So again, they're basically comparing low caffeine to higher caffeine. And what they found was there's no difference between 117 milligrams of caffeine on average per day versus 317 milligrams of caffeine per day. Remember, these are ranges, but we're comparing the 2 averages. And what they found was that there was no statistical difference in the birth weight, the chance of preterm delivery, birth length, head circumference, abdominal circumference, or the weight of the placenta. So clinically speaking, there is no statistical difference between consuming roughly 117 milligrams of caffeine per day while pregnant versus 317 milligrams of caffeine per day. Now, let's talk about breastfeeding. We're going to talk about breastfeeding just briefly because the data is there, but there's not a firm recommendation. Everything just says use common sense, use it in moderation, which is a common theme throughout pregnancy. So a couple of take-home points regarding breastfeeding. It's very important to know that if you consume caffeine while you are breastfeeding, that caffeine will make its way into the breast milk within about an hour. Now, if you think that you can just pump and dump so that you can give the baby breast milk without caffeine in it, you have to think again, because the breakdown products of caffeine include theophylline, which is still metabolically active. It still has a stimulatory effect. And so that appears 10 to 15 hours later. So a pumping and dumping strategy of the breast milk will not work for caffeine consumption. Now, that being said, how dangerous is caffeine or theophylline to babies? Probably not that dangerous, but we don't know. We do know for some babies in the nursery or the neonatal ICU, we actually administer caffeine and theophylline to the babies on purpose to help stimulate normal breathing patterns. Premature babies, for example, in the neonatology intensive care unit, have frequent episodes of what are called A and Bs, or apnea and bradycardia. And caffeine and theophylline have been given to these babies for any number of years to help stimulate a normal respiratory pattern. So is caffeine or theophylline bad for your baby? Probably not, especially if they're having episodes of apnea or bradycardia. But can you have too much caffeine and theophylline in the breast milk? Probably. There's no firm data to say so, but I would say common sense would tell us to moderate or limit the amount of caffeine we're consuming while breastfeeding. So again, caffeine is found in several foods and beverages. This is a list of some of the most common things that you'll find in your diet. Just in broad strokes, you want to know that dark chocolate has more caffeine than milk chocolate. Iced tea has any huge range of caffeine. These two examples that I found, Lipton Natural Energy Tea had 75 milligrams of caffeine in only 8 ounces of beverage, as opposed to Nestea iced tea, which had 13 milligrams in more than 2 times the amount of fluid ounces. Red Bull also has a lot of caffeine in it, 80 milligrams. Soft drinks have anywhere from 34 to 54 milligrams. So you do have to factor in what type of beverage it is and what the caffeine concentrations are. This was taken from a website called www.caffeineinformer.com. I don't know how validated their data is, but at least it gives you a frame of reference. Here we're talking about coffee, probably the biggest culprit when it comes to our caffeine intake. And here's just some of the most common commercially available coffees. And you can see that they have the low end, which is less than 10 milligrams of caffeine per fluid ounce, and that would be McDonald's. But there's also 3 commercially available coffees that are above 20 milligrams per fluid ounce. So that's more than double the concentration of caffeine in McDonald's. And these 3 would be Coffee Bean, Seattle's Best, and Starbucks. So again, you got to figure out what the concentration of caffeine is per fluid ounce, multiply that out by the volume of coffee you're consuming to get your intake of caffeine via coffee. Finally, this is an article that proves that caffeine withdrawal symptoms are real. You should expect to have some headaches and some flu-like symptoms. And so, like I said before, I'll have some patients coming in that have flu-like symptoms or headaches, and they tell me that they stopped caffeine intake abruptly. And I tell them, well, that's probably just an effect of stopping the caffeine abruptly. Don't worry about it. But patients really panic because they think I'm blowing them off. But this article does show with a placebo-designed trial that caffeine withdrawal headaches and caffeine withdrawal flu-like symptoms are very real. And they're to be expected. So either taper yourself off or have a certain tolerance for these withdrawal symptoms. You know, especially if you're Googling headaches in pregnancy, you're going to find all kinds of mess. You know, I don't want you to get into that rabbit hole because I can't tell you how many patients come to me at like 10 weeks of pregnancy thinking they have preeclampsia. That's just something that you should not be Googling. It's just going to freak you out for no reason. And we know stress isn't good for you or the baby. So again, if you're quitting caffeine cold turkey, expect some symptoms like headaches or flu-like symptoms. Finally, back to the take-home points. Number 1, limit caffeine intake, not only when you're pregnant, but also trying to get pregnant and while you're breastfeeding. Remember that the FDA and the American College of Obstetrics and Gynecology have a rather strict intake recommendation of caffeine to less than 200 milligrams of caffeine per day. The World Health Organization is a little bit more lenient, says less than 300 milligrams of caffeine per day. The fourth point is coffees have different concentrations of caffeine. So definitely look into the concentration of caffeine per fluid ounce for the coffee that you like to drink and factor in how much coffee you're having. Is it 1 cup, 2 cups, 20 ounces? And then lastly, again, very importantly, caffeine withdrawal does have symptoms, headaches, flu-like symptoms. So either taper yourself off the caffeine, or if you're going to stop cold turkey, have some tolerance for some of these symptoms without worrying about the flu or worrying about the headache. Okay. So hopefully you found that helpful. That brings us to the end of this episode. Of course, if you have questions or comments, leave them below. Any suggestions or feedback are always welcome. And hopefully, like I said, this gives you a foundation to build upon so that you can tell what's true and what's not true so that you can go forward and make the best decisions for you and your baby and your pregnancy. So take care. I'll see you next time. Until then, stay healthy and stay educated. Thank you for watching this episode of Patient Education for the Educated Patient. I hope you found this content both helpful and meaningful, and that you'll be able to use it to live a healthier life. If there's any questions, please leave them in the comments section below. I do welcome feedback, so please also leave me any comments or suggestions in the comments section. Please subscribe and turn on the notifications, and I hope to see you at the next episode. Until then, stay healthy and stay educated.